Hi, Dr. Jennifer Penrose here at Penrose Physical Therapy in Lacey, and I want to talk to you a little bit about balance and falls. It kind of sneaks up on people usually. They might have a fall, or maybe you just start noticing that you're grabbing the rail, you're using the furniture to walk around in your home. You start not wanting to go to certain events because there might be uneven terrain or a curb, and your world starts to get a little smaller. Maybe you're feeling a little dizzy and off, and you don't feel like you can take that trip with your family. And so when you do that, you end up getting weaker, and the balance system actually gets worse. You don't need to live like that. I want to talk a little bit about options here at Penrose Physical Therapy and how we treat balance. But first of all, you should recognize there are three systems that affect balance. There's the visual system, there's the somatosensory system, so your feet feeling the ground and knowing where you are in space based on that feedback from your feet and your joints. And then you have your inner ear or your vestibular system that gives input to the brain as well. So any of those systems can start to not work well. And really what we have at Penrose Physical Therapy is called Upright VR, which is a very advanced virtual reality system that has a gyroscope in it, multiple sensors, and it can decide which system is most impaired and then give you a nice detailed report on that can also be sent to your doctor. And we can set up very specific games for you to deal with those issues, whether it's the vestibular system, the somatosensory, your feet not feeling the ground, or your visual system, or often a combination of all three that is very targeted and precise. That system alone used to cost $200,000 and only in hospitals. And now we have it at Penrose Physical Therapy. And it gives you that edge of knowing what really is affecting your balance. The second thing that we have in terms of advanced technology, if you have peripheral neuropathy in your feet and you can't feel the ground, we have what's called a Stimpod, which is pulsed radio frequency, and that resets the nerve to the point where people can feel the ground again. And then when you get that sensation back, your balance is not as much of a threat. So there's research out there showing if you have peripheral neuropathy, you are 16 times to 23 times more likely to fall. That is huge. So if we can get those nerves working again with the pulse radio frequency, you will decrease your chances of falling. And we've had pretty good success with that. So reach on out for information on that. The third thing that we use with our balance people, depending on if you had something that affected your brain, is hyperbaric oxygen therapy, or if you had vestibular neuritis, so a nerve that had inflammation affecting your vestibular system. The hyperbaric oxygen therapy, what it is you're breathing oxygen at a higher pressure. And that higher pressure in the hyperbaric oxygen chamber allows basically a 500% roughly increase of oxygen delivered to your brain and to the vestibular nerve. And it's allowing the brain to heal in ways that researchers are a little bit surprised about. But what they're finding with people who've had a concussion or a mild traumatic brain injury is 1 to 5 years later after the occurrence of that injury, doing the hyperbaric treatments, they were able to show cognitive improvement in some of those post-concussion symptoms and cognitive thinking. So the cognitive scores went up, and then when they did imaging of the brain, it also validated that the brain did undergo healing. So very cutting edge to be able to have the hyperbaric oxygen therapy here. There's other uses for it, but I just wanted to talk about it with the balance section in particular. So if you are finding that you're missing out on things with your family, you are struggling with ongoing dizziness or balance or peripheral neuropathy, there are things now available that just weren't available before, and we'd be happy to help. So reach on out to Penrose Physical Therapy here in Lacey, and we'd be happy to set up a consultation regarding your balance and what, if any of those or all three of those, would be applicable for you.